Welcome to Your Way Now. We're Sue and Sarah, coaches supporting people living with cancer and those moving beyond it. Each episode shares real stories, expert insight, and gentle tools to help you feel more supported physically, emotionally, and mentally. This is Your Way Now.
Get the strength you want and need from real stories and expert voices. It's time for Your Way Now.
And I think we're live, and welcome to this episode of Your Way Now with myself, Sarah, and
Sue. Hello.
and with our special guest today, Louise, who will do all the introductions for herself, because I'm sure you can give yourself much more specific titles, Louise, than what I can call you. So, please
that's
introduce
interesting.
yourself.
Well, that's really interesting because today I just had a chat with my friend called ChatGPT and getting over my own imposter syndrome about what I call myself. So apparently I do fulfill all the criteria to call myself a neuroscientist, but more aptly it would be an applied neuroscientist. I hold a master's degree from King's College, but more than the master's degree from King's College, it's the combination of the work you do. So I have a BPS certificate in neuroscience as well, and also a postgraduate certification from Cambridge University in brain neurology, brain neuroanatomy. We'll get it right one day. By the way, everyone, I'm terribly dyslexic, so there are times when, even though I can read fluently and quickly, I do get my words jumbled up. So
Can you spell neuroscientist?
I can spell neuroscientist, but I'm not going to do it.
Not today.
Not today, anyway. She says, we're feeling very, very like, oh, under the cosh, that raised some stuff for me.
I'm surprised that ChatGPT said you can call yourself that with that array of qualifications and experience.
Thank you.
Yeah, really
Thank
impressive.
you. Thank you.
Yeah.
I'm also a hypnotherapist of many years experience, and I'm trained in a whole array of, as Sarah alluded to earlier, techniques. It's a factor of age, guys. You know, you stay in the therapeutic industry for a long time and you learn lots of techniques, but the art of having lots of techniques is working out where they work for people and whether you can communicate the benefit of them in a way that lands with people and helps them. And so that's really what my goal is. That's really what I do and what I try to do on a really daily basis with people. So shall I just say I just expand a little bit on what I do.
Yeah.
So I work with a brain tumour charity called Brains Trust. Their work is for people at the point of diagnosis and their journey through, wherever that journey might take the individual, because of course brain tumours are very complex things. Some people have a very poor prognosis if they are in the space of rapid onset glioblastomas or astrocytomas, which are cancers of the little scaffolding cells in the brain which support the neurons. So they're really busy little cells, and they're the ones when we talk about glioblastoma and astrocytomas. Then we also work with people with meningiomas, and meningiomas are tumours of the meninges, which is the lining between the brain and the skull. And of course, the big problem with brain tumours is the skull is hard. So a brain tumour doesn't have anywhere to go but into the soft tissue of the brain. And this is where there's a lot of confusion about what's benign and what's malignant. At the end of the day, if you have a lump of tumorous tissue, pushing down in really serious areas of your brain, it's going to be life-threatening, even though the tumour itself isn't malignant. I think that's a really important point when people are thinking about brain tumours to bring out, because lots of people don't really understand that, and there's been lots of press, oh well, it's all right, it's not malignant. Well, no, but it's in a really sensitive place and it's going to grow and press down on your breathing centre in the end. Then that is a really serious tumour.
Yeah. Yeah.
So then there's acoustic neuromas, which occur within the vestibular and hearing systems of the brain. Colloid cysts grow. We're very famous person, Davina McCall, had a colloid cyst, and that grows within the structures of the cerebral fluid area. Particularly, they're called ventricles, where our cerebral fluid is, and the cysts form inside those areas. And what can happen is that they can grow and block the flow of our cerebral fluid. So that means lots of things stop working very well. We get brain fog. We can get all rafts of weird symptoms that doctors get quite confused about. And eventually, if the cerebral fluid flow gets blocked, it becomes very serious. Yeah. So there we
Really
go. That's a big run around brain tumours. And what I do for people with brain tumours and for people with cancers is I help them with scan anxiety. I help them using hypnosis and using a raft of other tools. Hypnosis, I help them with the scan anxiety, and I help them with while they wait, which is very similar to your way now. I do while I wait. And my focus is helping people stay with their life, not their illness. And it's so hard when you are in the bureaucracy of the health system. So I work hard with my coaching as well as my hypnosis, as well as neuroscience insights to help people overcome where they get stuck.
And I think scan anxiety is a really big subject, Louise. So, I mean, give us some ideas about how you actually help people, manage that scan anxiety. I know that's a term, isn't it? We call now scan anxiety. It's probably
Yeah.
in the dictionary. But yeah, how do you sort of help people navigate
Okay.
sort of
Well,
anxiety that's going on?
if I may, what I'd like to say is that I use scan anxiety is recognized as an umbrella term now, because it can mean the scan itself, and that could of course mean a CT scan, an MRI scan, or any other type of scan, an MRI, any type of scan. But it also encompasses whether people are using contrast dyes, which also includes people's discomfort with having cannulas fitted, which
Yeah.
also includes the fear, because some people can have big reactions to those
Yeah.
dyes. That's not straightforward. And then there is the whole process of the amount of time different scans take. Then there is the bureaucracy of organizing the scan, of it being cancelled, and then there are surgeries. So we use all of those. So then there may be surgery, and then there may be pre-operative prehab and post-hab, and all of that area. All of it relates to, because there isn't another way to place to put it, really. So I just often draw up a big umbrella and say, here's the umbrella term. What's your flavour of scan anxiety? And then underneath that is while I wait. Back to your question, which is what are really essential parts? Well, I'm going to say straight away, as a neuroscientist, I approach everything from that perspective. Also a psychotherapist and hypnotherapist. But let's look at what the neuroscience tells us about our behaviors. One of the important things is that if the brain does not know what or how you want to behave, or how or what or who you want to be, it cannot deliver it to you. I'm going to let that land for a minute. If the brain does not know what you want, it's very good at knowing what you don't want, but the linguistic shift from knowing what you want to what you don't want is very, very important. So you, as skilled coaches yourself, will know people will often tell you what they don't want. And in our journeys, we're talking with people on a cancer journey, we will hear this. Well, we will work with people when they feel, they got that shattered feeling that they've been destroyed. Okay, so what do you want now? It's really hard, which is why I loved what you said earlier, Sue, about pragmaticness. It's so important that we really do have to have these conversations. So knowing what you want. And of course, there's multiple areas, and neuroscience also tells us that we construct our reality in the moment. So what you want to be and how you want to behave when you have a scan may be subtly different to how you want to behave when the phone rings because you're expecting a call from someone and you don't know what the news is going to be. So you start to realize there are lots of nuances to how behavior needs to be augmented on this journey. And people don't get the chance or the opportunity enough to articulate that. They don't get told, if you keep doing what you've always done, you're going to get stuck in the same response. You're
Yeah.
smiling, Sue. Go on, you've got something to
No,
say.
no,
I
I'm
mean, we're
just
on the
noticing.
same page, aren't we?
Yeah, and I think it's really interesting that, what you do can be applied from such an early stage right through to through the whole anxiety, whether it's scans or whether it's blood tests or whether it's that waiting period that people find so difficult. But also with the people that I work with, yes, I do take a pragmatic approach to it to really help them to focus on what they want now, and language is so important in that. And that's just a classic coaching thing, isn't it? You know what you don't want, but you don't know what you do want yet. So it's very much focusing on what is most important to you.
Yeah.
Yeah, fascinating that you can. And do you work with people from that sort of early stage right through on a one-to-one basis, or is that
No, I tell you, I tend to do a lot of group work through Brains Trust. I'm doing more one-to-one work, and I'm open to more one-to-one work. However, what I would say is that it's a journey, and we don't know how long. So it's not, when people engage with us, it's really hard to say it's going to be, one session or two session, because often what they need during the journey is the face that keeps turning up. And I
Yeah.
know that sounds really weird, but what they don't often get in their cancer journey is a consistent face when they go in for treatment. I mean, I don't know what Sarah's experience was, but I know that my brain tumor clients might see the registrar, they might see a consultant, they might see a cancer nurse, they might see this person, and all of those positions can change personnel.
So that consistency when things are so chaotic,
Yes.
important. Is that what you found, Sarah?
Yeah, you just never knew who you were seeing, and that was the point. And that actually just did layer on sometimes another level of anxiety. There was never any consistency in terms of your care. Even when you actually go and see your oncologist, you might sometimes see the registrar instead of
Yeah.
your normal oncologist. Mostly I see my normal oncologist, but sometimes I'll just turn up and there'll be somebody else in place, and I'm not, you don't know me. So yeah,
Yeah.
it's
So you trust that they got the information and they've
yeah, but
spoken
it's
to each other. Yeah.
yeah.
So
And
that's
I know this, and you probably know this, Sue, because you've been working in this space a long time. So I've been working with Brains Trust for about 14 years now, 13 years, and we're connected to them as a family, not because of brain cancers, but because my husband had a serious brain trauma in an accident when he was a teenager. And so when he was in his corporate role and was offered the opportunity to spend time working with a charity, this seemed like a really good fit. And as with many things, when you're a couple, if one of you gets very involved in something, it's sometimes easier to just be there with them on their journey as well. So I've thoroughly learnt so much, and the privilege it is to work with my clients, and I do call them clients at Brains Trust, is immense. So when we went online in COVID, we realised that the pressure of COVID created another element of discomfort for people. And you know what? It's not really changed. The consistency of appointments just doesn't happen. People get changed. The phone rings, your brain tumor cancer surgery has been cancelled, and it's delivered like they're outpatients. It's just like it's been cancelled. And these poor people have been prepping for a really traumatic experience, for something that's going to be a really difficult experience. They don't know how they're going to come out the other side,
yeah.
No.
which is where it's really important for me to pass on and teach the. I'm not going to say what I'm going to say. Teach patience, teach acceptance,
Yeah.
work with people to understand that the person whose brain gets knocked around in a surgery is going to come out different, but it's still you. Let's remind ourselves who you are. And that's when I always try and help people to think about who they really are, not the title of their job or the title of their stuff, but who they really are, who their friends are, who their loved ones are, what they love, because what they really love, and stuff like that. So in techniques, you asked me about techniques. I'm going to go back to that. So really connecting with the self in the moment, really knowing how to be in a moment. So I work with people around the what's going on in the brain, why we go into overwhelm so easily. So I do talk about the autonomic nervous system a lot, but I also talk about why is it that when we're stressed for so long and we feel collapsed, we've still got all this stuff going on in our head? And that's because we've got a different network of noradrenaline running around, making everything think more quickly in our heads. So once people start to understand that they have control over that, that's great. So the techniques I use are body based, and I use one called from a family of psychosensory techniques. And I don't know if people are going to be listening to this or whether they're going to be watching this. So it's a beautiful technique where you just put your hands together. Ladies, follow me, and you just very gently rub your hands together. Now, this pulls into operation the neuroscience of touch and what touch means to us. And it also sends a message via the nerves from the tips of our fingers all the way through into our somatic area, into our somatosensory area, where our hands are overrepresented. So hands are really, really good to use in this area. And we can breathe. And breathing also makes a fantastic shift. So these are the core of the techniques, because what I've found is people can't think their way out of overwhelm.
Yeah.
You can't think your way out of overwhelm.
You can't. It's like however much you want to. And actually, if you don't mind, I'd just quite like to share a very quick story while we're doing this, because actually it's quite a good time. Well, I went for a scan only a month or so ago, and for an MRI scan. And I was actually really calm and relaxed on the table, and it was absolutely fine. I was actually nearly falling asleep at one point. And then all of a sudden, they had actually asked me if I'd wanted the radio on, beforehand. So they put the headphones on, and I said, yeah, I'd put the radio on. And of course, after it didn't come on straight away, and I was nicely relaxed. And then after about 10 minutes, the radio suddenly kicked in. Now, I had all these things whirring around my head because you got the MRI sort of sounds, which actually I'd become accustomed to and was actually using to my advantage. But then the radio actually gave it a different thing, and I became oversensitized. And I started to feel really overwhelmed on the table. Didn't know what to do about it because I couldn't move, because it's an MRI scan. You can't move during an MRI scan. And I got through it, and things are pressing where they shouldn't press. I just became very overwhelmed with all the sensations, and I couldn't do anything. And I felt very trapped. And I came back, and my husband is here with his daughter, and they sort of took one look at me, and they went, "Are you all right?" And I went, "No." And I just burst into tears, and I just became really overwhelmed. And I didn't expect that trigger, but all of a sudden, it's amazing you said earlier about how the brain responds to things that you don't necessarily realize and expect. And it was like, whew, and I thought I was fine, but actually, really, I wasn't. Mm.
And of course, what we never know is when we think about what you're experiencing is and this is so there's so much out in the world at the moment about treatments for this and treatments for that. But we are all so unique, and we all have, I'm going to call it the upstairs and the downstairs to our brain. The downstairs of our brain, where we have no words. It is built on sense. What was that?
The hand model of the brain.
The hand model of the brain. Yeah.
I Flip your lid.
And you flip your lid. And
Yeah,
I've
yeah.
got, I've always got my brains here as well. I always use these lovely brain models. So when we talk about flipping the lid, if you're watching this is the frontal cortex goes offline. It goes offline because it becomes overwhelmed with noradrenaline and excitatory neurotransmitters, and it can't focus on decision making. So if you flip your lid and you go into other behaviors, and those other behaviors don't really have words. Now, this is really important to your experience. I don't know whether it was music playing on the radio or whether you came into words or whatever.
You know what? I couldn't really even hear it properly. It was like a fuzz. And I think there were all the other noises, and it wasn't great quality, and it was just all like,
Trying to work out the
yeah, I was
lyrics.
trying to work it out. I think that was the thing.
And so you try and work it out, which means you try and focus, which means you pull on more adrenaline, which means you're more busy neurotransmitters. So there's more energy in your brain to try and solve the problem of what's going on here and how do I control this? Because it was a new experience. But what we don't know is, and this is one of the challenges for people who are traumatized through diagnosis or through treatments or through medical processes, is you don't know because there's no words, because trauma collects in the area of, I don't want to call unconscious or just call it non-conscious area. But it might then at any point say, okay, have this as a gift, and send you back through a spiral of really powerful feelings. And this is where I do enjoy using the hypnosis, because the neuroplasticity for hypnosis really helps us learn more quickly how to overcome scenarios that you've just experienced, which you're so resilient, Sarah. I know how resilient you are. So you were able to just keep breathing through it, and just, even though it was really, really unpleasant, you just got through it and survived it. One of the big techniques I teach is how, once we've learnt these techniques, and we were doing the hand, and you can do the lovely shoulder work, just stroking down the shoulders. I've crossed my arms for those listening. Cross your arms over your shoulders and just stroke down from the top of your arms all the way down to your elbows. And you can come onto your forearms if you want to. It's really simple. It's really lovely. And what this does also, it just sends that message, I'm safe. It slows down the brain waves within the brain if they've been very busy from the busyness of the busy neurotransmitters and the activity. And also it sets you up, then you can stroke around your face. So I'm just very gently stroking around my face now. It's really lovely. A really lovely technique.
Massage.
I know you love it, don't you? And the reason the face works so well, and Sarah's also obviously just a fantastic aesthetics practitioner. She knows.
Back in the day, not anymore. I've pivoted, Louise. I've
pivoted. But the thing about our faces is that we are face first. We are moving forward creatures. We're supposed to go forward, and we have so many receptors in our face that when we actually touch them so gently and slowly, that we send that lovely calming message straight into our brains, because the trigeminal nerve picks up and connects, and it goes into the back of our brain. So higher up than it would be if we were stroking our shoulders. So it kind of does it kind of magnifies the effect, amplifies it is the right word. So
does it work with the feet as well? Because funny enough, I was just saying to Sarah earlier on that I've it's almost subconscious, but I find I rub my feet together, kind of like when I'm for comfort.
Yes, it's a comfort. It's a sensory comfort. So of course your feet are represented in your somatic area as well. So that messaging will be coming up, and you'll be learning. And I don't know who rubbed your feet. Maybe that's old. Maybe your mummy used to rub your feet.
Maybe, yeah.
Maybe. Well, all mummies rub their babies' feet, don't they?
Yeah. Probably not as I got much older. She had 3 others to contend with, but yeah.
But maybe when you were
little. But we find it's comforting. We might have had reflexology and found that was very relaxing. We might have had massages. So we form these connections with what soothed me. And then when we quieten down, it means that our body can have a sense of that oxytocin from touch
Right.
or
Okay.
that serotonin from feeling good, because often, because of the overwhelm, we're not able to pick out the nuances of those feelings. They're there waiting to get a look in. They're kind of going, we are here. It's a lovely thing to remember. It's just that we have to calm the body down in order for those other
Interesting.
experiences to the other neurotransmitters to do their jobs. It's a
Right.
little dance, keeping
Mm.
everyone calm. And then, which is why noticing is so good. I use a notice metaphor all the time. I use the idea of a vibrating red star, and noticing. You don't have to name the noticing, but notice it, number it, start your bilateral work, whether you're just rubbing your hands or using. I've got these little brains I use for bilateral stimulation as well. Sarah knows about my brains. I throw them
Sue's
around in
seen the
rooms.
brain. I borrowed the idea from the workshop.
Um, so all that stuff is really, I use a collection, and I do it every time we meet, because we do the 4 sessions, introduction, scanxiety while I wait, and calmness and confidence in procedures. And then we always do a weekly reset. So, except when I can't do the work because something has come up, but that means that everybody knows that that there's someone on there all the time. And this is where this hypnosis varies from how I used to work with clients in the past, where I would work maybe 3 or 4 sessions. We'd get the situation would be fixed. There isn't a fix in life, really. It's ongoing. And so, and we construct. So we've got that sorted, and then we go through our life, and then something else pops up, and it's just the same. And that is really true of the cancer journey as well.
Mm.
It
And what I
really,
like about what those exercises that you've just shown us is that they're subtle enough that you can do them in everyday life
Yeah,
without anybody
yeah.
thinking, "What's that person over there doing?" On the bus or in your day-to-day or at work or in a
Especially the
situation.
hands.
Yeah,
oh
the
You
yeah,
see it
maybe not
really.
this bit so much,
But
but
no,
the passing backwards and forwards,
then, yeah.
things that you can
but
do anywhere that yeah,
But
comforting.
with bilateral stimulation, you're right. So at the moment, for those that aren't watching, that they're hearing, I've just taken a pen and I've put the pen into the midline of my body. So the pen is sort of in front of me. And you just take the pen out to the left-hand side, bring it back into the middle, take it out to the right-hand side. Take a deep breath and breathe out and breathe in and breathe out. And get your rhythm. Rhythm. The brain loves rhythm. The body loves rhythm. That's why all of us use these gorgeous metaphors of waves, or, the breeze rippling through a tree systematically. We use all of that type of metaphor to help engage the brain with rhythm. The pen is brilliant because you can put it under a desk.
Mm.
So if you need a break at work, you're overwhelmed, you do these movements, because your body will tell your brain, I'm changing. There's a lot of neurolinguistic program in this, but there's also a lot of, this is raw neuroscience, where you're using your body to control your brain. So that's a lovely one.
Respect.
Very, very good for meetings with consultants. Because
Yeah,
you
well,
can
panic
because the
attacks.
consultant's going to say, what are you doing with your pen? Or what are you doing with your pen? And you can say, I'm doing some bilateral stimulation because it helps me keep my ears open and keeps my
Well,
stress down.
Yeah.
I had a couple of panic attacks when I went in to see some of the consultants in the early days as well. I didn't even realise that was something I had, because it's not something I'd actually um, experienced before. But obviously, I went into a room, I'd suddenly feel like I was going to pass out, and actually, you know what? What was really the most bizarre thing was, instead of actually them giving me some comfort and trying to explain to me what was going on, they left me to it. They
Mm.
left me in the room having a panic attack, and then they came back when it was over.
Wow.
Yeah,
Oh,
that one lands. I know.
that is just like it just. So I suppose there's an element of this when we walk through the medical procedures, that we project our ideas. And this is a really important part that you do in the coaching, and I do in my coaching. we project onto these people fantasy images of caregivers. And I know that sounds awful, but we project that onto them. They're going through their world going, I do this, I do brain surgery, or I do breast surgery, or I do this surgery. No, that's not my corner. Oh, does that make sense? But we've
Yeah.
projected on to them that they are a caregiver across the board.
Yeah.
And what they do is that they live in the silo of their expertise. And once we get that, it gives us back our agency,
Yeah.
and it allows us to, and so I use a lot of the imagery of transactional analysis and a lot of things about, well, rather than trigger the child in you, you move back into the adult and you can go, okay, this person works in a silo, their expertise, they're standing on the shoulders of giants, which is a phrase I use, in their silo.
Yeah.
Which means they may know nothing about that silo over there, and some of them really don't.
Mm.
And it's a really tough message when you need care for your brain to be able to take on board, because you just want someone to hold you and hold the space with you.
Yeah. I mean, there's no logic, because logic sort of goes out the window a little bit anyway, isn't it? And as you
No
say,
words.
someone just to
It's all
hold and
out,
yeah. So as you
comes
say,
from the no word
you
space.
come and comfort me and come and protect me, because you've definitely gone back into a child and need that safety, which is completely lost in that moment.
Yes. Yeah. Until you get coaching, until you
Yes.
get what you want,
As we
until you
try
start
some of that.
you start to structure that understanding deep inside you. And I always say to my clients, I'm not Pollyanna. I'm not saying this is perfect, but guess what? The more you practice it, the more flexible you become, the faster you get to recover from a hiccup, and that lands.
Yeah.
Because you told, I saw you at a talk. We were both at Sparfest last year together, which is well, we met prior to that, didn't we? And you were giving a beautiful talk, which was very inspirational. And you shared about this one where you're tapping on the shoulders as
Oh,
well, and you mentioned something about how it stops trauma from settling into the body. It'd be quite nice to hear a
so
bit about that.
yeah. So butterfly taps come from a therapy. Well, I first of all thought they came from a therapy called EMDR, which is an eye movement, a desensitization reprocessing, which is a trauma therapy, which basically brings memories up and allows you to apply resources to them and then settles them back down in a much calmer way. So it's, again, it's you can use imagery or any other ways of doing this, but this is rhythm. And it's the rhythm and the bilateral rhythm working, keeping the brain working across both hemispheres evenly, which really, really helps in this. But it came originally from a psychologist who was working in Mexico after those Mexican earthquakes, I believe, in the late 60s. And he obviously had insight about bilateral stimulation. And his research showed him that the people he got to do this process, because there weren't enough drugs to go around, beta blockers is another way of holding heart rate and energy in the body down so people don't form trauma. But he just got people doing this tapping. And he found that the people who tapped didn't have PTSD post. Obviously, they had lots of stuff they had to deal with. They'd lost their homes, they'd lost their loved ones, but they didn't get flashbacks. They didn't get deep-rooted PTSD. They were
Yeah,
able.
that's amazing.
It was a way of processing. It was a mechanism for them to slow down, so they could breathe and let the brain settle and make sense of what had happened, because that's what is needed for the brain to process, resettle, put a timestamp on it, put it, have words associated with it that don't cause another response, and it certainly don't cause flashbacks. There we go. It's really fascinating.
And
I do
that's
this so much.
cool now, Sarah, and our viewers, listeners are going to hear that. How much would that have helped you in that consulting room then when they walked out and left you to have a panic attack. Such a simple thing could have just
Yeah, all of these tools I
saved
think would have
that,
been,
and
yeah, because
yeah.
I didn't know any of them really, at that point. I mean, I was very much in the early stages of my coaching journey. I had started studying some coaching, but I certainly hadn't studied any sort of somatic work,
Yeah.
and any somatic practices by that point at all. And I just think, yeah, Louise, you're amazing, and thank you for sharing all these with us and with the listeners, because I'm sure, anybody actually listening, I would recommend that you do hop on and actually watch this so you can actually see the techniques, because I just think, if you find, I'm sure that so many of our listeners would find these really useful.
And I'm going to say and add, I was blessed yesterday. This is a final thing. We were blessed yesterday on one of our calls with Brains Trust with having someone who is a respiratory expert, and somebody came on. Now, this is really cool. Somebody came on and she said, well, I try to do breath work, but then I get myself in a muddle because I'm counting with my breath and all the rest of it. And then I find I get a bit lightheaded or I start to dissociate. And and she said, what should I do? And I said, stop. I said, you only breathe to the pattern that works for you. But the consciousness of saying, including breath into this touch, is where you get your agency back. So, of course, with panic attacks, there is a shift in the relationship between oxygen and carbon dioxide, but we really need to help the breath and keep the breath regular and calm down so people don't hyperventilate as well. But when you're using your hands to help you establish rhythm, how clever is that?
It's really, I mean, it's just, yeah. And I say, in the facial massage, I just sit in the bath. I just love it. It just feels wonderful.
Well,
So,
I think we're really close to time, aren't we? So I'm going to say thank you so much for inviting me. I love to help people with these techniques and just, being there for people. It's a real privilege to do the work.
well, we're
Thank
really,
you.
really pleased that you came on.
Absolutely.
And I mean, if people really feel they need to reach out to you, Louise, how can they find you?
They can find me on the internet, Louise Baker. They'll find me either with a hypnotherapy number by my side, or they'll find me on LinkedIn, or they'll find me on Facebook. I look like this in all the pictures. I've got this, I kind of look like this.
Louise Baker
My look
Neuroscience.
doesn't change. Sorry?
I said Louise, but let's Google Louise Baker Neuroscience and we should find
Or
it.
Louise Baker Hypnotherapy, you'll find me. Or While I Wait .uk, you'll find me there as well.
And we will share
So
the links in the show notes as
yeah.
well. So we'll get all those in as well. Just a quick question though that's just crossed my mind before we sign off this episode with Louise. I do a lot of meditation with my clients. I do meditation and some breath work, but a lot of meditation, visualization. And I know you do that as well. But I just think it would be really interesting for our listeners to hear about what your take is in terms of what the differences between hypnosis and meditation are.
Okay, well, the first thing I'm going to say is that if you go back to basics and look at the definition of a meditation is a period of focused attention. So focused attention is what we're all seeking to achieve. So at that level, there's absolutely no difference between a hypnotic trance, a hypnotic focused attention, or a meditative focused attention. The biggest difference I would say, and I think this is it's so swapping over now, is that hypnosis always used to be orientated towards a very very clear intent. So a hypnotherapist would use the hypnosis focused attention to take someone into a very specific behavioral change. Whereas sometimes the meditation is about the meditation for the meditation's sake, for the ongoing programming of flexibility. Remember that calmness is only the tool to flexibility of being able to manage what comes into your life. And sometimes we forget that it's the journey. It's not what we're really trying to do is increase our flexibility to manage these difficult situations that arise. So, and I think that meditation in the more classic sense and in the Buddhist sense and in some of the other cultural senses is more about just the very gentle long-term process of acceptance. Whereas hypnosis is about like, I want to change this habit, or I want to do this, or I want a very specific meditation with my inner child to see if we can dislodge that block deep down inside and have that articulation with that imagery. Did that
So
answer that? There you
really,
go.
so really, when I take people through specific visualizations per se, you know, which might be an inner child or meeting your wise self or whatever it might be, they are really variations of hypnosis.
They are. They are. Yeah.
Okay.
So a lot of
I'm a
that's where I said
hypnotherapist as
you're
well.
a well, I know you're a hypnotist, Sarah. I've watched you hypnotize people. So, but remember, hypnosis is a focused state of attention, and that is where, if done in relaxation, it can aid the neuroplasticity in a different way. But really, what we're doing is taking people. We can do what you'll hear them. I learned in a child work like 40 years ago, when I was being trained as a hypnotherapist and psychotherapist. You don't have to do inner child work in hypnosis. We can often have conversations with our inner child on a regular basis during the day, especially when it's kicked off. No words. Oh, why did I respond like that? My
Yeah,
inner child's messing me around.
yeah.
Give it a little tap, little hug, off I go again. So
Reset.
Well,
flexibility, yeah.
thank you, because I I find it very interesting, and I'm sure, as I say, the listeners will as well. And we're just really grateful that you came on today to be a guest for us, Louise.
Well, I'm
It's
really grateful, and lots of love to all of you on your journey out there. From the bottom of my heart, just one foot in front of another, one thought at a time, and you will come out where you
And I
need
love
to be.
that. I think that's why we need to end all the podcasts, is in terms of what is the guest words of wisdom, and and you just shared that for us. So, thank you so much.
Thank you, Louise.
Take care, and for anyone listening, we will see you on the next episode. Anything you
Yes.
want to sign off with,
No,
Sue?
no, I'm learning so much. I've got to take it all in. Thank you very much, Louise.
Take
You're
care.
very welcome.
Bye bye.
Get the strength you want and need from real stories and expert voices. It's time for Your Way Now.
Thank you for listening to Your Way Now. If you have a story you'd like to share, or would like to be a guest, or have ideas about what would be helpful to hear on future episodes, we'd really love to hear from you. Please remember you're not alone on this journey, and your voice really does matter. So until next time, this is Your Way Now.